Hello, my name is Jonquil Pettigrew, and today I will be presenting on AMHH services and exclusions. What are AMHH services? Here on the 1915 I-SET team, we like to call it a bucket or basket of services. All of these services are front-loaded at the beginning of each package period, and those services are adult day services, HCP habilitation and support, respite care, therapy and behavioral support services, addiction counseling, supported community engagement services, care coordination, medication training and support. Progress note documentation for all AMH services must include the date of the service, qualifications of staff delivering service, what service was provided to the member, confirmed service was provided either face-to-face or telehealth, services benefited to the member, symptoms, needs, goals, or issues addressed during the service, member strength utilized or developed during the service, progress towards health goals identified in the IICP and the crisis plan. First, I'll be covering adult day services. Adult Day Services is a community-based, non-residential program designed to provide health, wellness, social, and therapeutic activities in a structured, supportive environment to help members meet their needs and goals identified in the IICP. Services provide supervision, support services, and personal care as required. This service cannot be provided via telehealth. Services should support members' community engagement and integration and cannot be provided in a residential setting. Service standards provided face-to-face. Client is the focus of service delivered. Clinical oversight must be provided by a licensed physician on site at least once a week. And when not on site, the physician must be contactable by clinical staff. Each service must be documented in the member's clinical record. Evaluation and documentation of members' progress towards habilitative goals should occur weekly. On this slide, I'll be covering eligible activities versus service exclusions. Those eligible activities are care planning, behavioral health treatment, biometrics monitoring, such as weight, blood glucose level, and blood pressure, medication administration, nutritional assessment and planning, individual or group exercise training, training in activities of daily living or ADLs, and skills reinforcement, and other social activities. Those service exclusions are the following. Services must be provided in a residential setting are not eligible for reimbursement. Formal education or vocational services are not eligible for reimbursement and not eligible for reimbursement if services are provided simultaneously with other services of the same scope and nature. Please note down at the bottom, medication administration and support in adult day services may be provided by a medical assistant graduated from a 2-year clinician program and authorized healthcare professional in addition to other qualified professionals. Up next is who can provide it. For nutritional assessment and planning, it must be a certified dietitian. General adult day services can be provided by licensed professional, except licensed clinical addiction counselor, QBHPs, and OBHPs. Medication administration may be provided by a licensed physician, an authorized healthcare professional, a registered nurse, a licensed practical nurse, a medical assistant who has graduated from a 2-year clinical program. Next, I'll be covering home and community-based habilitation and support services. Habilitation and support services are intended to reinforce, manage, adapt, and retain a member's established skills to meet a member's need. Members are assisted in gaining an understanding of their behavioral and medical health needs to support self-management and continued integration within the community. These services may be provided in an individual or group setting in the home or community. Services can be provided to a member's non-professional supports, should be family or unpaid caregivers, with or without the member present, and is required to be provided face-to-face or via telehealth according to IAC. Service standards must be provided face-to-face or via telehealth with recipient, member, family, non-professional caregiver, etc. Service should improve the recipient's capacity to provide care for the member, regardless of the recipient's relationship to the member. The focus of the service should always be on the member themselves. Again, eligible activities versus those service exclusions. Implementation of the IICP, assistance with personal care, coordination and facilitation of medical and non-medical services to meet healthcare needs, skills training, training of appropriate use of community services, training and skills necessary to secure housing, money management training. And those exclusions are as followed: job coaching, purely recreational or diverse activities, services provided to a professional caregiver in any capacity, and academic tutoring. And who can provide this service? Um, be a licensed professional, except a licensed clinical addiction counselor, QBHPs, and OBHPs. Next, I'll be covering respite care services. Respite care services are a group of services delivered to members living with a non-professional caregiver and who are unable to provide their own care. These services are designed to be provided to the member in the absence of the caregiver to ensure continuity of care and member safety. Activities reimbursable under the services cannot be provided by the member's primary caregiver or by anyone living in the residence of the member. Services are to be provided by a qualified staff of the provider agency. Service standards. Services must be provided in the least restrictive and HCBS compliant environment available. This must be provided face-to-face. Telehealth is not allowed. AMHH respite care services may be provided in any of the following locations: member's home or place of residence, caregiver's home, non-private residential settings such as a group home or adult foster care. Location and level of service provided is based on the need of the member as described in the set approved IICP. Medication administration must be provided by a qualified member of staff. Respite care is provided for a short and defined period when the primary caregiver is unable to provide care to the member, and this is not a substitute for regular care. Eligible activities versus service exclusions. Those eligible activities are any activity normally completed by the non-professional caregiver, and those service exclusions are any service provided by a person living in the residence of the member, any service provided by the client's primary caregiver, services provided to a member receiving in-home care from a professional paid caregiver in any capacity, services delivered to a member living in a certified residential facility or supportive housing, services used to allow caregiver to attend school or to engage in employment-related activities. And who can provide it? General respite care services is licensed professional, QBHPs or OBHPs. Medication administration, a licensed physician, an advanced practical nurse, a registered nurse, a licensed practical nurse, a physician's assistant. Next, I'll be covering therapy and behavioral support services. Therapy and behavioral support services can be provided in an individual or group setting to either the member or their family/slash non-professional caregivers. When delivered to the member, therapy and behavioral support should develop skills, behaviors, and behavioral health management techniques that support the development of the member. Services can also be provided to the non-professional supports in the member's life and should assist the support in implementing a behavioral support plan for the member. Service standards. Services must be provided face to face with therapy recipient. It can be the member or the member's family/slash caregiver. The member must be the focus of the service. The service must be time limited and structured. Services may be provided face to face or with telehealth according to IAC with the member or with family member or non-professional caregiver with or without the member present. Eligible activities would be medication administration, assertiveness training, stress reduction techniques, development of socially acceptable behaviors, implementation of behavioral support with family, caregivers, etc. Who can provide it? A licensed professional, except a licensed clinical addiction counselors or a QBHPs. Next, I'll be covering addiction counseling services. Addiction counseling services are provided to members with minimal risk of withdrawal and minimal or manageable medical conditions to educate the member or the member's non-professional caregivers in supporting the member in their addiction recovery. Services can be provided to both the member or those of the member's non-professional care teams such as family or unpaid caregivers. When provided to caregivers, services can take place with or without the member in attendance, so long as the member is the focus of the session. Service standards. Services must be provided face to face or via telehealth according to IAC with the member, family member, or non professional caregivers. Addiction counseling must consist of regularly scheduled sessions, must address addiction recovery goals. Member must be the focus of the service, must be provided to members with a substance related disorder who also meets any of the following requirements: minimal or manageable medical conditions, a minimal risk of withdrawal, does not have an emotional, behavioral, or cognitive condition that would prevent the member from benefiting from this service. And again, eligible activities versus service exclusions. Those eligible activities would be education on addiction and substance use disorders, stress management training, relapse prevention training, referral to available community recovery support programs, and anger management training. Those service exclusions would be education only counseling, services provided to professional paid caregivers, members in need of detoxification services, member who is in immediate danger to self or others and cannot be safely managed with AMHH services, and members endorsing symptoms or risk of withdrawal. And who can provide it? Will be licensed professionals slash qualified addiction professionals and QBHPs. Supportive community engagement services. Supported community engagement are services that engage the member in community activities that will lead to the development of skills to increase community engagement. The goal of these services is to support and improve the members' involvement and engagement with their larger community in a meaningful way, establishing and developing relationship with community organizers relevant to members' need. Services should be delivered to those clients who are unlikely to pursue or to be able to pursue such community engagement without assistance of the provider. Services should support general skills development that can prepare the client for success in an employment setting. Service standards. Services must be provided face to face with the individual, must be provided in a community setting, should provide a benefit the member is unlikely to achieve without support. Services should help to establish and develop a relationship with a community organization, involves collaboration with the community organization to develop an individualized plan that identifies specific support, identifies organizational expectation, identifies training strategies, identifies timeframes, and identifies responsibilities. Those eligible activities versus service exclusions. Those eligible activities are task completion training, personal safety coaching, training on timely and consistent attendance, provide problem solving training, volunteering or community service, coaching on the use of assistive technology device and adaptive equipment. Service exclusions would be agency compensation of member, job specific task training, services provided to a competitively employed member, services provided in a group setting, services including explicit employment objectives. Who can provide it? Licensed professional, QBHPs, and OBHPs. Care coordination services. Care coordination consists of services that assist a member in gaining access to needed medical, social, educational, and other services. Service should adequately address the mental health and/or addiction needs of the member. Care coordination should be utilized to ensure that the needs and goals described in the IICP are implemented to fidelity. AMHH and BPHC. Member can be enrolled in both AMHH and BPHC. For members approved for both programs, the number of AMHH Care Coordination Service Units or BPHC service units will be adjusted as follows. Active AMHH package, number of authorized BPHC units based on the time left until the AMHH evaluation is due. If the AMHH end date is less than 6 months away, the BPHC end date is aligned with the AMHH end date. If it is more than 6 months away, the BPHC service is authorized for the 6th month. Active AMHH authorization periods remain unchanged. If an individual applies for AMHH after they have already have an active BPHC package assigned, the number of authorized AMHH care coordination units is reduced to account for the BPHC service package assignment. Service standards. The service must be provided at least once every 90 days, and this service can be provided face to face or via telehealth according to IAC. eligible activities versus service exclusions, the needs assessment, developmentation of the IICP, referral and linkage, monitoring and follow up, evaluation, direct assistance in gaining access to services, linkage of the member to appropriate services. And those service exclusions are the direct delivery of medical, clinical, or other direct service services provided in a group setting, services that go beyond assisting a member in gaining access to needed services, traveling to and from appointments with the member or members, training in housekeeping, laundry, and cooking. And who can provide it? Licensed professional, QBHPs, or OBHPs. And finally, I'll be going over medication training and supportive services. Medication training and support services are a group of services to be provided to the member or the non-professional care team of the member to support the member's ability to maintain continuity of medication regimes. Can be provided face-to-face or on behalf of the member, can be provided in an individual or group setting. Service standards. Services not provided face-to-face must be documented to focus on and behalf of the member. When provided to the member's family or caregiver, the service must focus on the member and benefit the member's ability to maintain medication. When provided in a residential treatment setting, services may include component of medication management services under the Medicaid clinic option. Right? Eligible activities. This is for face-to-face or on behalf of the member. And those are monitoring medication compliance, providing education and training about medication, monitoring medication side effects, providing other nursing or medical assessment, evaluation, direct assistance in gaining access to services, linkage of the member to appropriate services, training family or non-professional caregivers to perform eligible activities. And on behalf of the member, transcribing medication orders, setting or filling medication boxes, consulting with the attending provider or AHCP regarding medication-related issues, ensuring linkage that lab and other prescribed clinical orders are sent, ensuring that the member follows through and receives lab work and services pursuant to other clinical orders, follow-up reporting of lab and clinical tests results to the member and physician. Service exclusions would be medication management, counseling, or psychotherapy when medication management is a component of the service, medication and training that is billed separately for the same visit by the same provider, coaching and instructions regarding a member's self-administration of medication, services provided to paid professional caregivers. Who can provide it? Be a licensed professional, an AHCP, a licensed registered nurse, an LPN, a medical assistant who has graduated from a 2-year clinical program. Thank you so much for joining me today as I talked about AMHH services and exclusions. Again, my name is Shankle Pettigrew, and I'm a part of the 1915 ISET team.